Hello, good morning to everybody. It's a huge pleasure to have this first international webinar with this issue. And we have here the editors of Global Perspective on Children's Health Literacy. It's a pleasure to have Rosie Nash, Vaughan Cruikshank, and Chandel Helmer here. Thank you to be here and to have the opportunity to debate your book and the chapters that we have participated. My name is Cristina Vaz de Almeida. I am president of Portuguese Health Literacy Society, and we have here also as a speaker Professor Vânia Costa, also vice president of Portuguese Health Literacy Society. So we have the editors Rosie Nash, and I welcome to be here. And we are going to start to see the background of the book, Global Perspectives on Children's Health Literacy. The floor is yours, Rosie Nash. Thank you very much.
Thank you. I'll just share some slides just to keep us on track and keep us to time. So as Christina said, our presentation tonight is on our global perspectives on children's health literacy. Chandel, myself and Vaughan were the editors of this amazing compilation, this book, and we were really fortunate to work with 17 really distinct countries to bring this story or narrative together. And it's our great privilege to share with the Portuguese Health Literacy Society this evening, our time, but your morning. And we understand most of you have had your coffee now, so we're happy that you're alert and ready for learning. So in Australia, it's really important to us that we do an acknowledgement of country. So before we start, I'd actually like to do an acknowledgement of country. And so I want to acknowledge the Palawa Pakana people of Lutruwita. So Lutruwita is Tasmania, where Vaughan, Chandel and I are sitting this evening. And we want to acknowledge those traditional owners and custodians of the land upon which we live and work. And we pay respect to elders past, present, as the knowledge holders and sharers. We honour them. Their strong culture and knowledge is vital to the self-determination, wellbeing and strength of their communities. And we stand for a future that profoundly respects and acknowledges Aboriginal perspective, culture, language and history. And in particular, I was just sharing with some of the other people before we commenced, I was fortunate enough this evening to be swimming in the waterways. So swimming in the beautiful ocean in Tasmania this evening with my son, before I came in to join you and do this presentation. And I do thank the Aboriginal elders who preserve the waterways for us so that we can enjoy the abundance of fish and the beautiful water to swim in. So this is our book, and I'm sharing a QR code here for you so that if you haven't been able to get your hands on a copy of the book or convince your librarians to keep a copy in the library at your university or your hospital or your clinic. This is a really important contribution. It is the first time that the health literacy discipline has considered the intersection between health education and community settings. And this came about because we noticed here in Tasmania that health, education and community were all treating health literacy as the other person's problem. And so what we wanted to do was seek to ask the question, well, is health literacy a health, education and community issue, or should it be treated separately? And how are other countries looking at this issue? And so I sent out an invitation to some colleagues when I was heading off on a Churchill Fellowship in 2023 for people to contribute to this book. And I was overwhelmed with the response. So we had a number of colleagues come back to us and say that they'd like to contribute. And then they shared onward to their networks, and more people came forward with their abstracts to contribute from their country's perspective on this important question. And so it became obvious to us that children's health literacy really was on the agenda internationally and really was seen as an important investment. And there were some excellent insights and recommendations that we'll share with you by the conclusion of this morning's presentation. And these practical recommendations are ready for translation directly into practice. So I know there are practitioners sitting listening. So we've got nurses, nutritionists, and other allied health professionals listening in. And we're hopeful that when you get your hands on a copy of this book, you'll see that there's some examples in here that you might be able to take and apply directly into your practice. So before we proceed, I guess it's really important to set the scene and think about what is health literacy. And so we think about health literacy in our research unit here at the University of Tasmania, the Health Literacy and Equity Research Unit, as very much informed by three things. So that is the individual. So the individual might have individual health literacy assets. We also know that that individual, be it a child or an adult, has a social network or support around them. And they may experience distributed health literacy, so they might be supported by the people around them. And then finally, there's the health literacy responsiveness of the organisations or services they're seeking to access. We talk about a social ecological model in health literacy. And so health literacy is very much a moving concept. And so where possible, when we're thinking about supporting the development of an individual's health literacy, we also need to think about that social context that they're situated in and whether or not those service providers, organisations and that community around them can also support them and meet them where they are. So we also know from the literature that health literacy is a social determinant of health in its own right. Health literacy can determine a individual's health outcomes, the educational attainment, social equity, and also productivity. And more recently, we've seen colleagues in Europe come out with a position paper on health literacy being a human right. So with developing these personal assets of health literacy earlier in the life course then, we know, again, from the literature that can influence adult health behaviours. And so there's very much a potential for us to redress inequities that we all see in our communities. So be they in Lisbon, in Portugal, or be they here in Tasmania, in Australia, we can serve to redress these inequities by supporting individuals to develop health literacy from childhood, but also examine what our systems are doing and how our communities can be supporting those individuals. So this book, as I said, was there to examine the global perspectives, and the authors that came back really engaged in this question around, is health literacy a health, education or community issue? And they were able to examine those intersections between those. And from that, it was very clear for us to see that really health literacy development is an intersectoral issue. So health literacy can be influenced, as we saw in the case studies, examples in each of those 17 book chapters, by culture and context. And each region and country has supported the health literacy development needs of their children and their communities very differently. So, for example, in Taiwan, we saw a completely different approach than we saw in Australia, and different actors and factors involved in that. So grandparents very much are part of the cultural fabric and upbringing of children in Taiwan. We see less of that here in Australia. And it's those sorts of details that we need to be aware of when we're coming up with interventions and thinking about how we can change policy and make improvements. So this international, the book includes a collection of 17 countries that have contributed to the book, and they provide a collection of important insights. We also, as I said, we've got a number of recommendations that can inform practice, policy and research. And so in total, there were 24 chapters written by 60 authors representing those 17 countries. The chapters were themed by section. So Vaughan took the lead on the education chapters, Chandel the community chapters, and I was fortunate enough to lead on the health section. Whilst we're arguing for the need for more cross-disciplinary work and intersectoral collaboration, it was essential for us because of the volume of chapters for us to break them into those theme areas. And so each chapter author was encouraged to consider the role of health literacy in redressing those health inequities in their region and make those recommendations. But importantly, we also asked those authors to think about how could their recommendations and their ideas be made portable to other regions. And so when you read the chapters, you'll see that nicely highlighted. So onto the chapters or the section that I was overseeing, the health chapter. We had Canada, England, Northern Ireland, and Taiwan represented in this section of the book. And it was very much a really interesting finding, and it makes sense when you think about it, is many of the chapter authors suggested this idea of, well, it has to be owned by someone for it to happen, but clearly it's not the responsibility of one or other sector. So it's not just with health, it's not just with education, it's not just with community. But how about if we had a situation where it was health driven, but education delivered? And so that was a really nice sort of piece of clarity that came through in the book and in that section in particular. The other thing that the authors made reference to was the importance of cross-sectoral efforts. The child's voice was also raised, and it was important that the child be involved in the development and design of research or interventions. But more so, and we're seeing more and more of this here in Tasmania, their role in informing policy. So getting the children at the table when policies are being drawn up. And then there was also in the health section a real acknowledgement of the role of policy, and that a health in all policies approach would be needed to support health literacy development into the future, so that we see health literacy being inserted across sectors and being highlighted there. I've already mentioned this concept of the social ecological model of health literacy, and certainly some of the authors in here made reference to that. And that it's not just with the individual. We can't just place it all with the individual, and we need to think about how we adapt services and systems to support others. And finally, digital literacy and also mental health literacy were raised as potential areas for future focus by the authors. So I just wanted to hand over to Vaughan to speak about the education section of the book. Thanks, Vaughan.
Thanks, Rosie. Yeah, so the education section had 8 different chapters in it, so it was quite a big section. And even though those chapters came from 4 different continents, there was still a lot of similarities between what they were talking about, even though the contexts were quite different in each country. So some of the common themes across the chapters. The first one there was about including health literacy in curriculum. So in some countries such as Australia, health literacy is already in the curriculum, which is a great thing. And other countries like Norway have actually recently put a new subject in their curriculum called public health and life skills, which links a lot to health literacy. And then other countries such as Iran were sort of really advocating for health literacy to be added to their curriculum because they felt that was a really good way of addressing a lot of those health inequalities in the country. Obviously, once health literacy is in the curriculum, we then need the teachers to be able to actually have good health literacy themselves, but to be able to develop that in their students. So certainly the Australian chapter talked a lot about how variable that health education could be, depending on how health literate the teachers were and how confident they were to actually develop it in their students. So professional learning was quite a big theme in some of these chapters, because obviously teachers need to be taught the skills to actually develop health literacy in their students as well as in themselves. So in Australia, programs like Health Lit for Kids were obviously mentioned as programs that could potentially contribute to a solution, and other countries had similar, I guess, programs or initiatives. Particularly in countries like Ireland, they talk a lot about co-designing these programs with young people. So actually asking children and adolescents to actually be involved in designing these programs and what they think is useful, which is really good. And obviously, health literacy as a potential help for social inequities was a really big theme across these chapters. So I won't talk about Bolivia and Portugal because obviously Christina and Sandra will talk about those chapters. But certainly in some of the other chapters, that sort of inequity and particularly in the German chapter is a good example. They talk about how the impact of social disadvantage can result in unequal health and education opportunities, but that situation needs solutions that often look beyond personal health literacy. So they talk a lot about organizational health literacy. So different schools actually becoming an organisation that is really good at developing health literacy within the people involved in that organisation. So certainly something for other countries to take on as well. But they're probably the main things there, Rosie. If I want to now, I guess, hand over to Christina and Sandra to talk more specifically about the Portuguese and the Bolivian chapters.
Thanks, Vaughan. I'm going to stop sharing and allow Christina to take
Okay.
control of. Yeah.
Well, thank you very much. I'm going to share the presentation. Okay, I believe it's considering what Rosie told about. I think you are seeing the
Not yet, but now yes,
yes. Okay,
full screen.
is full screen?
Not yet. You
Not-
need
Okay, I'll try. I believe it's right. Just a minute, please. It's right now. Okay.
yes.
I've been in the Council of Europe last December, and one of the things that Rosie told us that human rights, we present that health literacy is a social determinant for human rights, and this book speaks also about human rights. I think we have also explored the intersections between health education and community settings, and it was very and quite important to see the different school contexts of adolescents' competences and confidence. So our chapter is titled is Health is Not a Rock Science, the General, Nutritional and Oral Health Literacy of Portuguese Adolescents in the area of education. The team was constituted by these researchers. We were eight researchers, and we worked together for the results. So we know that health literacy is a public health challenge, and we have several studies and evaluations since 2009 with Christine Sorens, and we have a low level of health literacy. When we see the countries, we see that there is a variations from 29 to 62% of low health literacy. And 1 in 10 have insufficient health literacy. And 1 in 2 had limited, insufficient or problematic health literacy. So we know that Portugal is one of the biggest socioeconomic health inequalities in the European Union. We are going better, but we continue to have low income and low health literacy, especially in rural areas and low in immigrants also. So we know that education and gender are the main determinants of health inequalities. We know that Orkan says in 2018 is quite important that children and adolescents have an increased cognitive capacity to make decision making. And this can help health skills, health-related knowledge, and health behavior practice. We had in 2005 the implementation of the Portuguese Public Oral Health Program from 2006 to 2013, and at 12 years we grow up in the rates the field teeth index decreased from 295 to 1.18, and healthy gums improved from 26 to almost 52%. And in 2012, we have the implementation of national food and nutrition policies, the National Program for Promotions of Health Eating, and improvements of Mediterranean food. And nevertheless, we have 30% overweight, 8.5 obese children. We struggle to implement more fruits and vegetables versus processed food. So we know that dental and nutrition and health literacy among adolescents are scarce. In terms of methods, the aim is to measure the level of health literacy in general health, oral health, and nutrition through the self-perceptions of these young people from 12 years old to 19 years old. And also in the domains of health literacy, access, understanding, and also the use of health resources. We applied the key list questionnaire. It's original 20 questions from the developed HLS AUPT, translate for and apply from España and Saboganuns and Pacari in 2016. And we also have a panel of experts. And now I will give the floor to Dr. Vania Costa. And we also, just to reinforce, we apply a Likert scale from absolute true to not all true in the health literacy, food literacy, and oral literacy. Please, Vania.
Thank you. Thank you. So our results were that we construct this questionnaire, as Professor Cristina explained, with 20 questions, and we had questions from health literacy, general health literacy. We had some questions focused on oral literacy, and we had questions about food literacy. Our questionnaire was, we had a sample of 20 adolescents that answered to this questionnaire, mostly girls. It's always a question that we have more girls participating usually in this kind of studies, voluntary, because we have a convenient sample. And they were, of course, voluntary to answer this question with the consent of themselves and, of course, of the parents. So all these ethical issues were provided to have this kind of results. And we analyze the consistency of the questionnaire, and we have a very good result about the alpha Cronbach. So we have a strong internal consistency, reliable of the scale, which is interesting which means that we can use it more. Why did we decide to do this? Is because mostly we didn't have a questionnaire that was consistently to our aim, our goal, and that's why. And we had a very transdisciplinary team, so we thought that would be very good to do this as a team. So, what were our results? About the health literacy, we understand that there was a good confidence about health, but less confidence in confirming if this information was okay, if it was credible. And we know that there was almost 30% that was not quite true about everything that they read and the information that they can search about health. When we analyze the results from the oral literacy, we understand that they have good confidence about oral health, but less confidence in advising friends about oral health. So once again, probably they don't feel so confident because they know what they need to do, but they don't know if that it's enough to recommend others. There is probably a lack of confidence about information to transmit that to others. About the food literacy, they have very good confidence in food knowledge, but less confidence about the practice of the health diet. And this is also something that it's not new, because we know that usually people are, and also adolescents, they are confident about the food knowledge, but the theoretical part, but when you go to the practice, it's much more harder because you need much more competences to put it on practice. So there were some questions that support this. When I decide, I eat what I want. So of course they are confident about that, but they are much more difficult to say. They feel confident to say no to foods that may be good for their health. But when I eat what is good for me because it's healthy, they were not so confident about that. So our conclusions, Professor Cassina, can you pass, please?
Yes, of course.
So our conclusions was that we reach a questionnaire, a tool, Kili-son, that we realize that is a tool with good internal consistency and reliable for the Portuguese adolescents that can be used, that females participants tend to self-evaluate their oral literacy more positively than men's, and the men tends to self-evaluate their nutrition healthily more positively. But the things that is really interesting is that and your book is so good and so interesting about that, is that we need to put this issue to the table, because we need more studies to evidence health literacy, food literacy, and oral literacy among teens and adolescents, not only in Portugal, but probably around the world. And our main conclusion is that interventions in promotion of health literacy, food literacy, and nutrition literacy and oral literacy should be included in a transdisciplinary approach. And this transdisciplinary approach is the one that that makes sense to give more education and more capacity to adolescents to their healthy choices. So you were mentioning the importance of put these issues in the curriculum, and it's really mandatory that there is health literacy in the curriculum of the adolescents to provide the knowledge and the understanding and the application and the competences for them to apply to their own lives and their own family and around them, to be capable of make good decisions in health in all the areas. We focus in nutrition and we focus and in oral health, but of course all the other areas are for certain very important to do this. And thank you very much for this opportunity.
Thank you very much, Dr. Vania Costa, for your presentation and the results of our chapter. And then we will have the presentation of Dra. Sandra Lucia Montaño Rodriguez. And I believe she is here, and I will ask her to share the presentation, please. Dra. Sandra.
Hi everyone. It's a pleasure to stay here, and yes, we want to share our work. Please help me, Dr. Christine. Could you share our presentations, the volume team?
You don't have there. Okay.
Okay.
You have
I
presentation?
yeah.
Okay. Please.
Okay. I let me. Sorry. Okay. I don't know if Vou compartilhar?
Sim, sim, of course,
Sim.
por favor. And then you will pass my first slides. Thank you very much.
Conseguem ver?
Almost, yes. Can you
Sorry.
open
Yeah.
the slide, please?
Sorry.
Okay,
Yeah.
very much. So,
Sorry. I don't know.
no, it's good, it's good, it's good.
No, let me. Okay.
The second chapter that will be presented today is the breaking barriers with health literacy, oral health, and nutritional health education of Bolivian adolescents and youth. It was a pleasure to work with Dr. Sandra Lucia Montaño Rodriguez. And then please, next slide, Dr. Sandra.
Okay. Uh,
Next. Okay, just to show the team, the research team of 5 people. The leader was Dr. Sandra Lucia Montaño Rodriguez,
Thank you.
and we had other researchers. Please, next slide. Okay, we will present in 7 steps the potential role of health literacy in redressing health inequities in Latin America, Bolivia, the role of health literacy in redressing health inequalities in Bolivia, oral health literacy in Bolivia, nutritional health literacy in Bolivia, methodology, results and conclusions and recommendations. Please, next slide. So, the potential role of health literacy in Latin America. We know that United Nations Educational, Scientific and Cultural Organization, UNESCO, have analyzed the strong inequalities that exist within the countries in Latin America and Caribbean. So in the few last years, there has been an increasing evidence that there is a link between income inequalities, health, and education outcomes. Please, next slide. So the potential role of health literacy is that the steps in Bolivia. Bolivia adopts the multicultural approach in cultural and linguistic diversity. So the health principles can be also applied and disseminated through this linguistic diversity. In Bolivia, the major problem for many years, especially the access to education in children in rural and indigenous populations. And is one of the roles of health literacy in Bolivia, as other countries, is to promote empowerment and participation. When the communities participate, the results will be better for everyone. So health literacy in Bolivia, can you pass the slides, please? We know that the disparities are slowly closing with educations and increase the enrollment of people in Bolivia. And just a little bit behind, not. Pode ir bocadinho atrás, só atrás, só para terminar, se faz favor, atrás. Ok, pode ficar aí só. Thank you very much. So with the quarantine and the restrictions of schools and presential of students, what's happened at the increase the anxiety, depression, and stress, and other mental illness in children and adolescents, and this is quite change a little bit the involvement and the empowerment that Bolivia was in the progress of health literacy, and this affects not only Bolivia but all countries in the world. So this study, and please next slide. And I will pass to Dr. Sandra Lucia Rodriguez to speak about the next steps in this chapter. Please, Dr. Sandra.
Thank you, Dr. Cristina. About oral health literacy in Bolivia, oral health literacy can be considered the degree to which individuals demonstrate the capacity to obtain, process, and understand basic oral health information and service. About Bolivia, the Bolivian Oral Health Bolivia Country Profile by WHO 2023 registered the prevalence of untreated caries of deciduous teeth in children under 9 years of age, 45 period 3%. The prevalence of untreated caries of permanent teeth in people over 5 years of age, 39 period 2%, and the prevalence of severe periodontal disease in people over 15 years of age, 7 period 7%. And this is the situation of oral health in Bolivia. About nutrition, our study register about the nutrition state and based on based on the nutritional health literacy in Bolivia, the Global Nutrition Report in 2019 noted that 4% of adult women and 15.8% in adult men are living with obesity in Bolivia. We based it in another studies and before realized it in Bolivia, in Cochabamba, Bolivia. The methodology of this study. The aim of this study was to gain better understanding of the general health literacy and oral and nutritional health literacy in Bolivian students aged from 12 to 19 years old. This was school-based cross-sectional study concept in Cochabamba, Bolivia, involving adolescents of both genders from public and private schools. About the methodology, about the ethics statement, we registered three basic statements necessary. About the study was authorized by the Bolivian Ministry of Education, and the protocol previously submitted to the local institutional review board at the university. And sample authorization consent was obtained from the parents and participants before the survey was administered. About the methodology, this study involved 283 adolescents and young people, 137 female and 147 male, aged between 12 and 19 years. About the sample characteristics, Cochabamba is geographical located in the center of Bolivia, and its climate and geographical make represent entire country. And about the sample selection, the schools in Cochabamba is public private. They're divided in urban, region, and rural. About the survey, the questionnaire applied in this study was the Q Lives Ball, based on the European Literacy Questionnaire realized and published by Christian Sorensen. And I want to share the next part for the results for the non-researcher, Sandra Lucia Montano. Please
On the
continue.
results, we have a main table results of self-perfection or self-evaluation, where the students have shown that good health agree with the good health information and the capacity of comparing sources about the information and sharing them to the peers. In the smaller groups, they have followed health instructions, sources of health information that they can decide where to find the health information to use in the daily basis. And the consequences of their behavior, they have shown that perhaps they have the information to decide what's good and what is wrong about the health information, they can't they show less result about the consequences of their actions. You can pass to the next one, please. Vou passar para o próximo. On the nutrition, health, and literacy part, they have shown their knowledge about healthy food and unhealthy food. They can classify the healthy and unhealthy food, but they can decline with the facility they have that they have to decide which is healthy and unhealthy. So their behavior, and they know that they have the knowledge about what is good and what is not fine for their health, but they continue eating food that is unhealthy for them. But they also have the knowledge about the impact on their health of this unhealthy food. In the next table, we have oral health literacy. We have some different results because they know about the importance of the oral health. They agree, they know about the oral health, they have the capability of advising their friends and family about oral health, the importance of doing the oral hygiene and the quantity of toothpaste, but they don't shown as good results as they shown as the last questions in the part of going to the dental care. We find out that most of the participants of the study have good self perceptions of their health and knowledge, skills and capabilities. Despite the positive indications of the responses, we have made some more. We saw more studies in the larger groups, as UNICEF. And demonstrate that we need to improve, we have to improve the results and do more health inquiries with more information and doing more education in community sectors. Social inquiry, we have seen that social inquiries are the major barrier on health, because of the different results that we have comparing the populations, but also Paulo have been working on reduce these inequalities. For concluding, in this age gap from 12 to 19 years old, we have a better understanding of the nutritional health and oral health about the students. We have seen different and relative heterogeneous predominance of agreement on the results, on the general health and the general health and the nutritional health and also oral health. Besides, most of the participants have more positive health perceptions of their knowledge, skills, and capabilities, but the results on the oral health were dispersed because of the last questions that is focused on the oral health, providing of health services, because most of the responses were negative. They agree in few groups, but we also have more responses that are negative in all the study.
Thank you very much.
Thank you.
You can stop the sharing the slides, please. Dr. Sandra. just to stop the sharing. One of the critical analysis that we can do with this study is that what CDCs tell us that from knowledge, the self-perceptions of knowledge is quite different from the use. These children have a very good self-perceptions and probably a very good knowledge. But I believe that we must improve concretely if they use the resources, because it's quite different. But this give us some lines to understand better the ways of health literacy. Thank you very much, Dr. Sandra and team. Please, Dr.
Thank you,
Sandra,
Dr. Christina.
stop to sharing the slides, and then we are going to hear again the editors, and then we have the slot of Chandel Helmer from Community Sections Insights. Could you stop the share to share, please? Okay, thank you very much. Please, Dr. Chandel Elmer, nurse and sociologist, editor of the book, Community Sections Insights.
Thank you. Thank you for all the great work that you've been doing. It was really nice to have the opportunity to hear the people involved in the study talk about the findings and the differences, and also the next steps. And a couple of things I just wanted to pick up on, like one, what you were saying is about the knowledge, and I guess part of my background is in sociology, and one of the things we used to say is the difference between knowing and doing is the power to choose. So it's like these kids and young people have all this knowledge and skills, but they're to put that into practice comes down to power, which of course is socially constructed, and they're all like, it's everyone and everything around them that enable or not them to put that knowledge into practice. And I think it's really important that we do understand more about what helps people to take those steps and put it into action. And the other point I wanted to pick up on was your point about the transdisciplinarity, and that really rings really true with this theme, the themes that run through the community section in the book. So in this section, we had countries really diverse. We had Afghanistan, Africa, Denmark, England, and USA and Wales. But what in amongst all of this diversity across the countries, the key themes were about thinking about health literacy as a social and a relational concept. So it builds on and is related to some of the work that you've been talking about, how health literacy is a social practice. It's not just about what we learn in books. It's not just book knowledge. It's what we learn from others around us and from those relationships we have. The other things that the authors talked about was the importance of a settings approach. And so this is, and super settings. So thinking about the socio-ecological model, or the way the social determinants of health and all the factors outside of health that make us healthy or not. This is where these super settings and settings approaches become really important. And that's where I see the link with the transdisciplinarity. It's not just any one discipline, and it's not just any one setting. It's about how well we work across those and build on the messages across all of those different levels, which then makes a difference. As Rosie said earlier, the health literacy being seen as a social determinant is key to how it works in the community. Some of the examples of settings, so both in the USA and in England, we're talking about the libraries as being key places for health literacy development. We also had schools in Wales with a program that teaches children about physical activity, but which is very much also about health literacy development. And so I think one of the other big learnings from this community section is around the power of collective impact, how when we come together through working across settings, across disciplines, and kind of mapping out, as it were, where people are, where they live, play and work, so that we can kind of do this development across all of those different places to bring them along. So that kind of collective learning is really important. So yeah, again, it was a real pleasure to be on the book and great to be working with you with your chapter developments too. So I'll hand it back over to, I think it's Rosie, again, recommendations and key insights. Yeah, thank you.
Thanks, Chandel. That's excellent. Thank you. So I guess that what we found were there were key learnings that were unique to each theme area, so each area of health, education and community. But we found there to be some overlapping recommendations and collaboration opportunities that were evident between those three themes. So coming back to that argument about, is this a responsibility of one sector or another? In actual fact, it was acknowledged that it really needs to be taken as a cross-sectoral approach to resolve the challenges that we see in our communities, our hospitals, in our schools around the health literacy development needs of our children. And so these were some of the recommendations that were overlapping. There was firstly the need to increase knowledge and familiarity, so really raising awareness about why health literacy is so important. So each of us, when we leave today's session, thinking about how can we raise awareness of health literacy in our practice, but also insert it as a bullet point in policy, and also elevate it in every setting that we can think of. Then there was this idea of collaboration between the sectors. Could we get the Minister for Health and the Minister for Education in the same room, perhaps? Wouldn't that be wonderful to have a conversation about, well, who's going to work together on this challenge? Who's going to help us to ensure health literacy is implemented in our schools and is thought about at the practitioner-patient interface? And then there was a real call across all of those themes, and all of the authors in every section really sang to the same hymn sheet, and that was around health literacy research that's focused on children and young people needs to be prioritised. And so if there's anyone in the audience that is with a funding body, that those funding bodies should be prioritising and funding a focus on children and young people. It seems illogical that we wouldn't be investing in our children and young people. And so the health literacy research needs to be given more funding and more focus. And I was heartened to see there was a really clear position came out of the WHO last week. I can't remember the exact policy piece, but it really was highlighting the importance of a focus on children and young people. And then finally, we need to take steps to work together. So opportunities like today to share knowledge are so important so that we can accelerate health literacy development globally. And we know this is a community and a collective asset. And we know that there's such a thing as distributed health literacy. So if I can increase Chandel's health literacy and support Chandel with her health literacy, she's likely to be able to help Christina and then Sandra. And in turn, we can actually accelerate that health literacy growth across, across communities. So we've got a number of key recommendations, and I know we're close to time, so I'll just pull a few of these out. So the first one was around increased research. So I think I've highlighted that, but really especially to be focused on social, structural and environmental approaches to health literacy in order to sustain health equity. So looking at it at a more broad way. Thinking about what sort of research are we doing with our children and young people? Can we use participatory research approaches? So encouraging them and empowering them to co-create with us some of the solutions to the challenges that they experience. And also to make sure that, that health literacy is enacted and valued in schools. So it's really, yes, it might be in the policy, and it might be in the curriculum, but is it being taught? And is it being assessed? And are we supporting our next generation to be health literate citizens? There was also a recommendation that we need to take steps to map the international curriculum to determine where and how health literacy is being taught and assessed. And Vaughan and I met with some colleagues from Ireland just on Monday night, and we've commenced that piece of work with Ireland to do a comparison with some work that we've done here in Australia. And a call out to anyone on this webinar, if you're interested in being we'll probably be asking 2 researchers from each country, because we'll need someone to do the translation. But 2 researchers as a minimum per country to join us, and we want to see if we can emulate the book, do something like the book, but actually map the curriculum across the globe to find out where health literacy is taught, where it's delivered, and where it's assessed. And so if there's anyone here that's interested in representing Portugal or Bolivia or other countries in your region, we'd invite that as a future collaboration. I think one of the big things that came out in that book as well was this idea of digital, that, you know, that digital's here to stay. And so we need to acknowledge digital. So health literacy and digital literacy, but also digital health literacy is the combined force there. And then there are many more recommendations in the book. But one of the things I wanted to finish with was to say that all of the work we do is really important. And I'm going to use Christine Sorensen's advice that she gave me at the end of my Churchill Fellowship. If we do not look at the economic impact and the social impact of our health literacy interventions, that's a missed opportunity. So again, there's a challenge for all of us to think about how do we measure the impact of these interventions and the work that we're doing on health literacy in our schools, in our communities. How do we ensure we can capture that financial but also that social impact in our communities? So I think we've already shared that slide. We've just been promoting the book, and we'd encourage you to promote the book to your networks. Have more events like this where you can share your chapter and the findings. And so, as I said, if you want to get in touch about that mapping project, there's a little bit more information there on the screen, and my email address is available there if you're keen to get in touch. And so thank you. I just want to say thank you. And I also was hoping if we've got time to have a few questions, but I also, in addition to that, I think we should stop sharing screen so we can see everyone's tiles and get everyone to turn their cameras on so we can take a photo of everyone before we all leave tonight or today, if that's okay.
Thank you very much, Rosie. It was a huge pleasure to have you here and your team because it's quite important. One of the lessons that I learned from Global Perspectives on Children's Health Literacy is that we must give voice to children and to young people. Here in Portugal, we are doing this work quite in an organized form because we need to hear the voice of the young people. And this also is a huge opportunity to have a cross-cultural roadmap with you in Australia and other countries, because when we speak about the MAP international curriculum, I believe that we must go into this road to have an international curriculum with best practice each country have and to implement on children. You also talk about the digital opportunities, and this is a very huge digital opportunity to be here. You are in Australia. We are in Portugal. So in other parts of the world, but we are together now. So digital will be one of the main roads for develop health literacy in youth and through also the competences of the teachers and researchers. It was a huge privilege. I don't know if someone has have a question.
Yeah, and I have thank you, Rossi. Thank you, Magal. Thank you, Sandal. Thank you, Dr. Cristina, all the Portuguese team, our Bolivian team. This is a great opportunity for Bolivia to share all the health situation, educational situation, and I think this is the first step for another studies. Yeah, thank you.
Okay. Then I don't know, Dr. Vania Costa, do you want to say something?
It is it is, first of all, it's very inspirational that you could join all these people around the world to think at the same time in this issue, or two issues: children and, of course, health literacy. So this is really wonderful. And of course, when we talk about children, we are including families, parents, because sometimes children need and they are able to do more, but sometimes parents need also to be more competent to help children, and they need this kind of skills to help children to reach their goals. So it was really, really a pleasure to hear your sharing and of all the book and all the work that you have, and also these final recommendations that it's the take-home messages. Thank you very much.
Thank you very much. I don't know if someone wants to share something, please. No? So again, to the editors of this wonderful book, Global Perspectives on Children's Self-Literacy, Rosie Nash, Vaughan Cruikshank, and Chandel Helmer, the editors, thank you very much. And from Portuguese Society of Health Literacy, thank you to the authors for the 2 chapters that improve, I'm sure, the health literacy in the world. Thank you very much. If you can open the cameras just to take a picture before.
I'll take.
You have, okay. Let's Maria Nunes. I don't know if you want to open the just to share this. Thank you very much.
Thank you, everyone.
This
Thank you very much for all.
So bye-bye. Thank you very much. See you next. Thank you.